4 more cases of coronavirus COVID-19 have been confirmed in Ghana. This brings us to 6, the total number of cases reported in the country. This was announced by the government at a news conference to update citizens on the outbreak of COVID-19 in the country. The Director of Public Health at Ghana Health Service, Dr. Bedu Sarkodie, who provided updates on the country's cases, said the new cases were also imported into the country.
On Friday, the 13th of March this year, 2 days ago, not too far, 2 more new cases were confirmed as COVID-19. They reported in 2 regions, one each from Ashanti region and the other Greater Accra region here. The first is a 56-year-old man, a Ghanaian, who returned from a trip in the United Kingdom on the 4th of March. He stayed in UK for 10 days and came back. He developed symptoms on the 12th of March, reported to a hospital in Obuasi, and the case definition met the case, that of suspected COVID. Samples were taken. The sample from this case was sent to Kumasi Collaborative Center for KCCR for research. And within a short time, the lab reported back to us that they have finished the assessment of the report, and this is another confirmed case of COVID within the country. The second is a woman, a female, and a student, Ghanaian student. She traveled out to the United States of America, stayed for, I think, 10 days or so. She came back on the 9th of March, and then on the 13th of March, she started having symptoms that later were evaluated to be compatible with a suspected case of COVID. Samples were taken, sent to Noguchi Memorial Institute Medical Research. Samples were taken on the 13th. The same day, we had a report from Noguchi that confirmed this as another confirmed case of COVID-19. Both are currently receiving treatment under isolation conditions, and both are stable. I'm talking about the 2 of them that were seen on the 13th. The second case was a 41-year-old Ghanaian male. He reported to Tema General Hospital on the 14th of March with a history of fever and acute respiratory illness. This symptom started on the 10th of March. This case had traveled to Germany and Turkey within the last 14 days. Samples were taken, sent to the lab, again, Noguchi Memorial Institute Medical Research, and the report came back as positive for COVID-2019. Both cases had no symptoms on arrival, but presented with symptoms of fever and acute respiratory illnesses, and they were not having signs and symptoms at the time they were crossing our borders. Both are currently under treatment in stable conditions. Contact tracing has started. This brings to a total of 6 confirmed COVID-19 cases in Ghana, with no death. And this is the situation as at the close of 14th March 2019. That was yesterday.
Meanwhile, the government is restricting all travels from countries hit by COVID-19 countries in a bid to manage the pandemic in Ghana. Foreign visitors who have visited any country with more than 200 coronavirus cases would not be permitted into the country with immediate effect.
All travel to Ghana is strongly discouraged until further notice at this point in time. Any traveler, except for Ghanaian citizens and persons with Ghana residence permits who, within the last 14 days, has been to a country that has recorded at least 200 cases of COVID-19 will not be admitted into the Ghanaian jurisdiction. Airlines are instructed not to allow such persons to embark. Border posts are instructed not to allow such persons into the jurisdiction. There will now be a mandatory 14-day self-quarantine for persons who are otherwise allowed to enter the Ghanaian jurisdiction. Guidelines for self-quarantine will be made available at the various Ghanaian ports of entry. Enforcement protocols are being deployed in collaboration with state security and health authorities. Persons determined to be unable to satisfactorily self-quarantine will now be quarantined by the state. Any admissible traveler who exhibits symptoms of COVID-19 will be quarantined and tested upon reaching Ghana.
Management of the University of Ghana has suspended lectures following confirmation that one of its students has been infected with COVID-19. The university has also banned non-residential students from coming to the University of Ghana campuses until further notice.
In a public address, the Vice-Chancellor of the University of Ghana, Professor Ebenezer Oduro Owusu, assured the university community of management's commitment to ensure that the spread of the disease is contained.
There's no cause to fear, since we're pulling all available resources and efforts together to ensure better management of the situation. The university has put in place prevention, detection, and quarantine measures, which have already been activated. Stay calm and remember to comply with the key preventive measures. That is, wash your hands regularly with soap and under running water, or use alcohol-based hand sanitizer. Cover your cough or sneeze with a tissue and dispose of it safely and responsibly. Avoid touching your face with unwashed hands. Keep a distance of at least 1 meter from others. I would like to assure you that the university is safe. Do not panic or create fear. For those resident on campus, remain on campus as we go through the required protocols of contact tracing to avoid any spread to the immediate and large communities. Non-resident students are required to keep away from campus until further notice. By keeping to these measures, you strengthen the efforts of the university, the nation Ghana, and the world to stop this pandemic.
In view of the suspension of lectures, students and staff who reside outside University of Ghana campuses and are currently off campus have been urged to keep away from the campuses until they are asked to return. In a statement, students and staff who reside on campuses of the university were urged to remain on the campuses. Staff providing essential services are, however, excluded from this directive. The University of Ghana Emergency Response Team has also linked up with the National Contact Tracing Team. In effect, social gatherings, religious services and sporting activities on the university campuses have already been suspended, and the suspension will continue to be enforced. Students, staff and the general public were urged to remain calm as the student's case is an imported one, and together with the institutional and national agencies, there is an integrated effort to handle the case at hand.